Hello, I'm Bob Challoner, the President and CEO of Southampton Hospital, and I'd like to welcome you to another edition of Focus on Southampton Hospital, your monthly program about the events, happenings, and programs at your community hospital. Today we've changed the format for this month's program, and rather than interview here, we're actually going to take you off to see one of our programs and see one of our wonderful clinicians at work. And the program today is titled Oh My Aching Back, one of our most popular programs at Southampton Hospital, a program about what we can do to strengthen, preserve, and hopefully avoid back pain. And I know that this is a topic that's very, very popular, and every one of us at some point has dealt with back pain, whether chronic, severe, or sometimes just that occasional twinge that we worry about. Certainly back pain impacts many, many people's lives. One of our most popular therapists is Debra Jensen. Debra has been working with us for a number of years. She works in our physical therapy department. She also works in our Ed and Phyllis Davis Wellness Institute. Deb's program is packed with much good information about what we can do to strengthen our backs, to preserve our backs. And rather than interview here, we thought we'd take our friends at CTV, would follow Deb up to her area and actually watch Deb in action as she presents some great information about my aching back.
So today we're going to discuss an issue that many people are dealing with, and that's back problems and what you can do about it. Some statistics show that over 80% of Americans have experienced back pain, ranging from mild symptoms like muscular aches to something more severe like herniated discs. For many people that are experiencing back pain, it affects all aspects of their life, whether they're sitting, changing their position, performing activities around their homes or at work, to the point where it almost has a decreased quality of life. So we want to look at different things that you can do on your own to help improve your back. So one of the things that we want to look at is what some of the structures that are involved with the back. I'm not going to go into a lot of the anatomy. We have some of the large muscle groups that are considered to be the global movers of the back that allow for the 6 movements of the spine, which is flexing, extending the spine, there's flexing the spine, rotating to the right, rotating to the left, side bending to the right, and side bending to the left. So that all of those movements are achieved through some of the larger muscle groups. But more importantly, we have some of the small muscle groups that stabilize the spine. And those are the ones that we want to look at in terms of exercise and how to maintain the health of your back. So we have, in the back itself, we have muscles that range from each level of the vertebral spine. And the spinal column itself is really, its main purpose is to protect the spinal column, the spinal cord itself. So we have these little holes where the nerves come out, and there's muscles that go between each of the vertebral processes of the spine that help to provide stability in the back of the body. We also have one set of those muscles called multifidus, which is part of what's termed the core. So when we look at strengthening the core, we are looking not just at all the abdominals. There's only one of the 4 abdominals that's really involved with the core, and that one is called the transverse abdominis. So those are the deepest of the abdominal muscles, and it provides stability in the front of the body. If you think about all the organs internally, your intestines alone can be, 22 to 23 feet long. That's just the small intestine. So all of that coiled up in this area, we need to have that stability in the front of the body. Because weakness in those muscles can cause some of those organs to actually protrude forward and provide a lot of strain to the lower part of the spine. So we have the transverse abdominis in the front, the multifidus in the back, and then we need also support underneath, and that's where the pelvic floor comes in. So your pelvic floor are 5 layers of muscles at the base of your body, and it provides some stability from underneath. If you use the analogy of a shelf, it's kind of like a shelf where you have a lot of heavy organs that weigh down, and without strength in this area, these muscles will actually sag slightly and cause some of the structures to move out of alignment. And that can cause impingement and pressure on the nerves, which can lead to some pain. So when we look at some of the ways of taking care of your back, these are some aspects that will become quite important. And one other thing about the spine itself, if you notice that there are some curves in the spine, these curves are there for a reason. If our spine was straight up and down, every step you take, every time you sit, all of that force will actually be translated up the whole length of the spine. So when we have the curves, they're actually there for shock absorption. So instead of forces going straight up and down the spine, they're actually distributed and displaced through this whole area of the spine itself. So one of the issues that's really important with maintaining the health of your back is to maintain the curves of the spine. So that's the anatomy in a nutshell. Some of the things that can cause back pain is trauma, so like a motor vehicle accident or a fall. Some disorders can cause back pain. Some disorders such as osteoarthritis or degenerative type diseases would fall under the arthritis category. Some disorders can cause back pain like scoliosis and things like that. Obesity can cause back pain because the more weight you have on your frame than your body is designed to handle, that causes more strain through the joints of the back themselves. Some hormones and medications can cause laxity of the joints, and that can also provide some instability. And muscle weakness can also cause issues with back. But the most common cause of back pain is actually poor posture and poor body mechanics. When I work in the physical therapy department, we see a lot of our patients for back pain, and I'd say that there's a larger majority that are dealing with back pain because of their posture and how they move versus a fall or a traumatic incident or anything like that. So we want to look at the posture and how we move as one of the things that we can do to take charge of our back pain. So what we're going to look at are some things not necessarily on the severe side of back pain. So if your doctor prescribes physical therapy or chiropractic adjustments, massage, or even going for surgery, we're not going to look too much on those aspects, but we're going to look at the things that you can do for your back to help maintain the health of it throughout your lifetime. So posture is one of the things that we want to look at, and Jacqueline here is going to help me demonstrate. So in sitting, one of the things that you can do for posture is called isometric strengthening. And what we're going to do is we're going to have a nice towel roll along the length of her back, and she's going to scoot her back right up to the towel roll. And the idea here is that this is going to give you some feedback. You want to have your hips against the towel roll. You want to bring your shoulder blades lightly around the towel roll and sitting up straight, bringing your head in line with the collarbones. And we want to also look at your leg position. When you're sitting in a chair, you want to have the knees and the hips in the same plane, in the same line. So if the knees are lower than the hips, what that can do is cause the pelvis to tilt in a way that can cause some pain to the lower back. So using a block or even a telephone book or anything like that underneath the feet can bring the knees and the hips in a straight line and reduces some of the strain on the back. So in sitting, using towel rolls, using a block or a book under the feet, really paying attention to how you sit, it becomes really, really important. The other thing we want to do is make sure that we're sitting on our sit bones. Many of us, when we sit, if we look at the model of the spine, these little donut-shaped things in the front are called your sit bones, the ischial tuberosities. And this is actually where we want most of our weight to be borne. But many people sit through their sacrum and tilt backwards. So, Jacqueline, I'm going to ask you if you can demonstrate what that would look like. So you want to sit back, kind of slump back. So if I take this out, okay, and you slump back in the chair, that curvature in this area is sitting more on the sacrum versus the sit bones. So making sure that we're sitting properly is one way to help. Because many people, when they're sitting, don't realize how much pressure, that sitting is actually one of the worst positions for your back. There's a lot of pressure throughout the whole spinal column when you sit down. So sitting is one of the worst positions for your back. So making sure you have support and sitting properly can be really, really important. Then the other thing that we want to look at is how we move. And one of the things that we want to do is whenever you change your position, you want to engage those deep core muscles. So lightly pulling your belly button in towards your spine. A lot of times I'll cue people to pretend that you're zipping up a tight pair of jeans, or if someone's going to give you a punch in the belly, you want to tighten up those lower abdominals before you actually change your position. So if you stand up, I'm going to show you a postural exercise for you in standing, but one of the things you want to do is always engage those core muscles when you change your position. So if we look at your posture, we can actually go right up against a wall, and what you want to do is bring your body 1 foot length away from the wall with your feet hip-width apart. You're going to bring your buttocks, the lower shoulder blades, the upper shoulder blades, and then the back of your head towards the wall to really get that sense of whether or not you're standing up straight. So this is an exercise I have a lot of my patients do downstairs, and we try to really focus on maintaining the curvature of their spine. So you want to first bring, no, actually you want to bring it at least a foot length away from the wall to start, because if you're too close to the wall, your lower back is going to arch away. So you want your buttocks, then you want the shoulder blades, and then try to bring the back of the head towards the wall. So the idea is that from the side, your ears are over the collarbones. You're going to draw a straight line down from the ear to the collarbone, and then down if your shoulder blades, hips, knees, and ankles are pretty close to being within a straight line. And then as somebody gets more, we look to see how much space is between the lower back and the wall. So here you have quite a bit of space in here. So if you pull in your abdominals a little bit, do you feel that, how it shifts a little? Okay. So once you get your posture straight, we want to look at how we move and how we change our position. A lot of things that people do without even thinking about it can actually hurt their back, and one of those is bending. So when I have showing people how to actually bend forward, you see a lot of people just flop on down and pick something up without support. So what you want to do is actually use your legs. So you want to kind of bring your feet apart a little bit, have a soft bend in the knees. You always want to bend from your hips. So when you're bending forward to pick something up off the floor, you want to use your legs to help with the motion, and always flexing from the hips, not from the spine. So that when you bend, you're really using those large muscles of the legs to help with the action. And then also when you're carrying something, you want to hold whatever it is you're carrying closer to your body. Because if you hold it away, even though this is a little light block, if you hold it away, it's actually heavier if you hold it further away from your body. So when people lift things up, they're like this. As we think about it, somebody lifting a squirming child, right? And you've got, something moving, you're holding out away from you. The weight is actually heavier because gravity is pulling down that whole distance from the object to your body. So the closer you hold it to yourself, the lighter it is and the less strain on the structures that are supporting your spine. So whenever you're picking something up and you're lifting those heavy boxes with all the flyers in it, you want to hold it close to your body. Yeah. And then if something is too heavy, what would you do?
Put it down. Have someone else.
Ask for help. Yeah, you want to have somebody help you. So I always tell people is don't be shy to ask for help. A lot of us think we have to do it all ourselves. So if something is really heavy, you always want to ask for help. You want to bend your knees when you're lifting, holding an object close to your body, and again, always bending from the hips. Those are just some tips that I try to teach some of my patients. Yeah. The other thing that can be painful for your back is standing for long periods of time, and how, not even walking so much. Moving is actually really good for your body. We're designed to move. We're not designed to be static. So the more you move, the more lubrication to the joints, and the better your body will feel. But when you do have to stand for long periods of time, so I have a few people that do food prep, if you're standing and writing, filing anything, a lot of times even grooming, brushing your teeth, etc., using something underneath your feet can be really beneficial. Most people, when they stand, will shift their weight to one side, and that causes the pelvis to lift on one side and lower on the other, compressing some of the structures on the lifted side. So using, it doesn't have to be high. You can use a phone book or a block, and you just put 1 foot up. So stand with both feet together, and then place 1 foot on the block, and notice how it takes some of the pressure off your back. So it keeps your hips on more level plane versus the shift to the one side. So this can be really beneficial to use for long periods of time when you're on your feet. You want to also shift, and you can change and use the other side so that you're shifting and changing your position frequently. So I have a lot of people do this. Now at home, if you look at the, like the inside of your sink, say you're washing dishes or prepping for a meal, if you open up the sink on the bottom, there's usually a lip about this high. You can actually place your foot on that area to help keep your hips more level. And those are all things posturally and how you move that can really protect your back. The other tip that I have is for when you're driving. So what a lot of people do is when you get in your car, you want to sit up as straight as possible. So those cues that we had before, right? You want your ears over the collarbones, not over your chest. So you don't want this position. You want to have it up like this, the shoulders back and down. So all of these things are really beneficial. When you get in your car, you want to sit up as straight as possible. You're going to adjust the mirrors in your car to your position sitting up straight. Then every time you get in your car, don't adjust your mirrors, adjust your body so that you're back in a good position. Because when we're driving, a lot of times we're like this, and this is called forward head posture. And what happens here is that the weight of the head will actually pull forward, and you'll end up getting tightness in the muscles in the neck. That then causes the weight of the head through time, gravity will pull it downward, the shoulders will roll forward, and you end up with that curvature in the upper back. What that can do is cause a whole host of problems. So besides pain in your back, it can cause problems with breathing. It can also cause problems with balance. So when we look at posture, it's really, really a key component in maintaining the health of your spine and preventing some of those conditions further down the road. The other thing that is really important for taking charge of your back is exercise. So exercising is a really, really important component. Walking, riding a bicycle, all of those things help to maintain the mobility of your body. Using other types of exercises like yoga and Pilates, core stabilization exercises are all really important. What I like about yoga and Pilates is that it's really mindfulness-based. You're really paying attention to your body while you're moving, breathing, changing position. It works on a lot of the stabilizing muscles of the body and also works on the flexibility of the body, all really key components in maintaining the health of your spine. The other thing that we want to do is watch our diet and lose weight if you need to, because the excess weight can cause extra strain to the joints themselves. And also what you eat can be really important. Certain types of things that we eat, like sugars, sodas, things like that, can have a problem with the bones of the body as well. So we want to watch our diet and make sure that we're eating properly. The other thing that we want to do is be very mindful and present. Start to notice when you have back issues and what is causing them. You know, many times that I'm working with patients, I have a lot of times to say, where does it hurt? What do you feel? Oh, well, my back hurts. Well, where? Your back can be a pretty large area. So you want to find out where in the back does it hurt? Is it centrally located close to the spine? Is it in the top, the middle, the bottom? Is it on the right or left side? Does the pain diffuse across the back? So there's all of these, this information can give us some more, helps us to better serve our patients. The other thing that we want to look at is the quality of pain. A dull ache might be more muscular. If it's radiating where pain is down the leg, there could be pressure or impingement of the nerves. Sharp pains could be something going on in the bones, like arthritis. So we want to look at the type of pain that we're experiencing and where it's located, what activities are precipitating it, what makes it feel better, what makes it feel worse, what positions. So there's a lot of information, and the more we're present, the more we're mindful, the more we can figure out what exactly could be causing this discomfort and what can we do about it. And that's also part of educating yourself. Other things that are really important with back pain is minimizing stress. When we have a lot of stress in our lives, we're holding ourselves really tense, and that can cause a lot of pain, a lot of discomfort, especially in the muscular system. So we want to look at decreasing and reducing stress as a way of relaxing the muscles a little bit so that we're not always in this position, which can cause pressure on the nerves. One way to do that is meditation. We have a lot of, stress classes here at the Ed and Phyllis Davis Wellness Institute and the Healthy at Any Age program. So we do have a lot of programs here to help with stress reduction. But other things that are really helpful for stress reduction and pain management is massage. Massage helps with circulation, the lymphatic system, detoxifying the body. It just makes you feel good. It's relaxing. It can help bring circulation and oxygen into some of muscle spasms if that's an issue. So for many people with back pain, getting massage on a regular basis can be so wonderful and really beneficial in helping them to reduce the pain so that they're able to do the exercises that will help them to maintain the strength. Because all in all, the most important thing is to really strengthen the muscles that support the spine, those little stabilizing muscles. So you're not going to the gym, you're not, lifting these heavy weights. When you go to a gym, a lot of times you don't see, these big guys with these big muscles on all fours, lifting an arm and a leg, stabilizing their spinal muscles. They're strengthening those big, large muscle groups, but not the little ones that can stabilize the spine. So there are some very specific exercises that are done for those particular muscle groups, and it's important to address those. So again, when we want to review what we're going to look at is posture. So when you go home, you're going to look in the mirror, make sure your shoulders are level, notice the position of your head. Again, that little cue that we did using the wall can really help. You want to notice also that, does my head tilt to one side? Does it rotate to one side? Are my hips also level? So we want to look not just at this area, but head to toe. Do I roll on the outer parts of my feet? How are the arches? How does that affect, do my knees roll in? All of these positional things have an effect on your spine. So something that the ankle can totally affect your back, just like something in the jaw can affect your back. So all of these things are really important because our bodies are connected. That old song, your hip bone's connected to your ankle bone, it's true. It's just through a series of kinesthetic articulations. So you want to look at all of those things when you get home. So you promise to check your posture?
I will, Deb.
Thank you. So, and then I have we have our little spinal model that we use to instruct patients in that also. You also want to really be aware of how you move. So those little tips that we talked about, how to bend, lifting, again, when you're lifting your heavy boxes and moving things around, how many times do we do one of these? You just swipe it along, we kick it out of the way. So we want to, take that extra few seconds to really be aware of what your body is doing and utilizing those techniques of bending from the hips, using the leg muscles, those large leg muscles, which are designed to do that, and really holding things close to your body. And of course, if it's too much, you ask for help. You want to also, the other thing is making sure that things are distributed evenly. A lot of times we grab a whole bunch of things on one side and we're uneven, and so you want to always distribute the weight evenly from one side to the other. And that holds true for pocketbooks too, or purses. I don't know if pocketbook is too long. So that's one of the things that we want to work on. And avoid twisting motions. That's also something that's really important. Mm-hmm. Exercise, 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 also very, very important. I know you exercise regularly, but start to think about some of those muscle groups that stabilize your body. We look at the core. We have 4 different sets of abdominal muscles. We have muscles that flex the spine. We have muscles that rotate and side bend the spine. But that deepest one is the one that we're really talking about for stability. So that drawing the belly button in and up without holding your breath. And there are some specific exercises that can be done to brace the abdominals, to help strengthen those stabilizing muscles, to help strengthen those little muscles that go between each vertebra of the spine. Pressing the small of your back into the bed with your knees bent can be beneficial for strengthening here, and then pulling the belly in, doing some, some of those Pilates moves where you're circling the leg and really keeping this part of the body stable will help to strengthen all those muscles that support your back. So looking into some specific exercises would be beneficial for that. And never ever push into the pain. That's the one thing I'll tell a lot of people is to not, more isn't always better. If you're doing this particular exercise and it hurts, you should stop for sure. And always check with a doctor if you do have a condition, a back condition, check with the doctor and make sure you know what exercises are safe, what does he not want you to do. So I do have that also when we treat patients in physical therapy. We want the doctor to tell us, is it okay for them to bend? Is it okay for them to extend their spine? Some cases and some conditions that may not be okay. So you want to check with your doctor before you start a program. And then of course, when we look at stress, we want to meditate and breathe properly. So if you try this technique, if you're experiencing discomfort, just resting your hands on your thighs, relaxing your shoulders, take a deep breath in through the nose, and then purse your lips and breathe out slowly through your mouth. And when you do that, you want your exhalation to be slightly longer than your inhalation, and that will help actually trigger the part of your nervous system that helps to relax your body. And again, we look at those stressful movements that keep us really tight and constricted. We want to relax and release some of those muscles. So if you take those breaths, it can actually really help to minimize that tension in the body. And that's something that's really helpful. It's also helpful for pain reduction. Does that feel good?
Feels so good.
Good. Excellent. You also want to laugh a lot.
I'm always laughing. That's not a
Laughing is one of the best pain management things you can do. It's so good. It's really good for you. It releases endorphins. So we use some guided imagery. In some of the yoga classes that I teach, we use guided imagery. We tell jokes. We have it really light and really fun. And that's something that you don't realize is that there are things that you can do for your body, like breathing properly, laughing, just being present, being aware of how you feel, taking a few moments just to meditate. These things are, A, will never harm you, and B, they're free. And so it's something that you can really, really be proactive and take charge of your health, take charge of the pain in your body, take charge of your spine, and really do things that you can help yourself with and that won't cost anything. Anything more severe than that, of course you should see your doctor and follow their recommendations, but there are so many of us that walk around with some aches and pains and things that are uncomfortable and think that we have no control over them, and we really do. We can make a lot of changes within our body to help maintain the health of our spine. So, do you have any questions?
I don't, Deb. You're doing such a good job. I find this very informative, especially for me. I have such bad posture, so it's definitely helping.
Thanks.
Well, thank you, Deb, for a wonderful program. It's been great to see you in action and also to learn about some of those helpful hints. One of the ones I particularly enjoy is to change my car mirrors, side view mirrors, and maintain a good posture. I know I'm frequently slumping down in the car as I'm driving. I'm going right home and changing the mirrors on my car. I think that's a terrific idea. And for any of you that are watching, if you'd like more information about back care and the other programs currently available at the Ed and Phyllis Davis Wellness Institute, please call their number at 631-726-8800 or check our hospital website at www.southamptonhospital.org. And as always, I'd like to thank our friends at CTV for producing this show each month, for airing it in our Southampton communities, and our friends at LTV in East Hampton for airing the program for all the communities we serve in East Hampton. I'd like to thank all of you for watching, and I'd like to invite any of you that have questions, any ideas for future programs, or just need help navigating the healthcare system here on the East End, please give my office a call at 631-726-8555. Thank you, everyone, and good health.